Welcome back. The seasons are changing, and as we get closer to spring, the changing weather could affect your health. Joining us today is Dr. Vallabh Dogra, a primary care provider at Mercy Health's Oregon Clinic, with insight on why getting an annual checkup matters and staying on top of all of those important health screenings. Thanks for being here today.
Thank you for having me, Amanda.
Yeah, I feel like a lot of people, they only go to the doctor when they're sick, but why is that risky?
So usually how I think of these things is majority of the times when people do get sick, it's the progression of the disease. Majority of the diseases, they stay silent for a long period of time. They only start showing the symptoms when it's progressed to probably a critical level at that point of time. That's majority.
It gets more difficult to treat probably at that point, right?
Absolutely, yes. At that time, you're already at a stage where you need like a very aggressive management because the disease has progressed so much. So that's why following up with your doctor is really important so that the disease gets caught in time. You're treating it decades before it even starts showing any symptoms.
Sure. So why, for somebody who feels healthy though, they should still go get that annual checkup. What are some of the things that you would do at an annual checkup? What are some of those things you would look for?
So usually with the annual checkup, it's just not the physical exam. Let's say if a patient is coming to see me, it usually starts with the whole physical exam. Then we go towards the history, the lifestyle changes. We make sure everything is, even if let's say if you feel healthy, I want to know what your 100% at baseline is so that I can identify that 95%. I know there's something off and then I need to treat that and taken care of.
You want to check your numbers, make sure all that looks good, right?
Absolutely. You need to check your blood pressures. You want to make sure your cholesterol, your kidneys, your livers, all the numbers stay pretty healthy, numbers look okay.
And then when you come back next week, you can have something to compare it, or next year you have something to compare it to.
Absolutely. You make sure you're noticing the changes. If anything needs to be done for it, you kind of go towards it, investigate further, and then kind of go from there.
Yeah. So why is it important then for somebody to have a primary care physician rather than, I'm sick, I'll just go to urgent care?
So now, to keep things in perspective, urgent care versus a primary care. Urgent cares are great. How I look at these things is, let's say you get a flat tire. You patch it up, you get going. That's how the urgent cares are usually like. But in order for your car to go, like, let's say 100,000 miles or beyond, you need to make sure you're getting the servicing done. You make sure you have a mechanic that takes care, knows your engine in and out so that your car actually runs on a longer term.
That's a great metaphor there. I love that. So and something else that you would do is write a script or write an order for some screenings. Talk a little bit about some of those regular health screenings that people should be getting.
So regular health screening starts as soon as you come to see your primary care doctor. Screenings, your blood pressures, your cholesterol. Usually people come in, you get a list of blood work, cholesterol, liver numbers, kidney numbers, your hemoglobins and everything. Those are the usual basic numbers that we start with. Then comes in as you kind of start aging, then your screening for your cancers come in. A lot of people don't know, but actually especially with women, the PAPs actually start at 21 years of age. Then comes the mammograms, then the colon cancer screenings, your lung cancer screenings, your prostate cancer screenings. So it's just like age dependent whenever they're due.
And it's important to get those because you can catch things early. Yeah?
Oh, absolutely. Even if we talk about, let's say, colon cancer, it usually starts as a polyp, which is essentially you can go in, take the polyp out, you're done with it, so that it doesn't go to a stage where it's a cancer or anything. So it's really important to get those screening tests done so that you take care of the disease even before it gets bothersome to you.
Yeah, so you might be a little nervous at home going, well, I don't want to go because I don't want them to find anything, but hey, it could save your life.
Absolutely, it does. It does.
Yeah, so if you are looking for a primary care physician, here's some information here, Mercy Health Oregon Clinic. Phone number there and the location so that you can stay on top of your health. Doctor, thank you for being here today.
Thank you so much.
Yeah, absolutely.